Okay, we are live.
Good evening, everyone. My name is Dr. John Millay, Superintendent of Martin County Schools. We're so happy to have all of our families, and I know several students may be watching and joining us tonight. It's my privilege and pleasure to be the superintendent of this school district. I want to thank all of our parents that are tuning in tonight, all of our students that have been working so hard, and of course, the mission tonight is to learn about how our response to COVID-19, how we will be responding to that, what learning will look like in our schools, and the options that parents have. This is my 28th year in public school education, and I have to say it has been one of my favorite. I've been enjoying visiting all the schools, meeting so many students, and I look forward to meeting more of the parents that are out there. Again, thank you for your time and for linking in and for being partners in this process. It requires a lot of flexibility. I know a lot of our staff, our teachers have worked so hard, and support staff behind the scenes to make school and learning go on. I appreciate the flexibility that's going to take to do this in the coming semester. So thank you again for being a partner in your child's education, and we look forward to having a great second semester.
Good evening. It's my pleasure to welcome you as well. Dr. Tracy Miller, Chief Academic Officer of the Martin County School District. And we have a great night planned for you. Lots of information to share. And so we have some friends here who are with us from the school district, and I'm going to allow them to introduce themselves.
I'm Nicole Fisher, the Director of Assessment and Accountability.
Good evening, everyone. I'm Garrett Grabowski, Chief Operations Officer.
Good evening, everyone. I'm Julie Sessa. I'm the Director of Risk Management and Employee Benefits.
Sorry. Hi, everybody. My name is Mark Coco. I'm the Safety Manager for Martin County Schools.
We do have Spanish, simultaneous Spanish interpretation available tonight. Si usted quiere escuchar en español, puede oprimir el botón Interpretation y después el botón que dice Spanish, español. Puede escuchar todo en español.
So this evening, we have a lot on our agenda, so stay tuned throughout the entire presentation. We're going to share with you our learning options that will be available, continue to be available here in the Martin County School District, where we educate all students for success. We have our learning option data and operational considerations. We are going to share with you about the pandemic crisis response team that has been guiding our work throughout the pandemic, the quarantines, unique here to Martin County, a way that we have tackled some of this work, the important health guidelines for families, our COVID dashboard that's available at the very moment to all members of the public, and of course, our upcoming Parent University sessions. So just earlier this week, the Florida Department of Education issued an emergency order, and that order has given us some very specific guidelines as to how to proceed through education throughout the pandemic, through the spring semester. And we have shared with you this evening that order. We have shared with you this evening the educational plan and assurances template that we will be completing as required by the Florida Department of Education. It's the same plan due from every district in the state. And I am going to share with you now part of the video announcement, but it's available for you to preview the entire video. This is the announcement that we heard just Monday from the governor.
And to our parents. Remain closed in key pockets of our country. Today's announcement doubles down on Florida's commitment to our students and to our parents. And the announcement is this: schools will remain open for in-person instruction and we will continue to offer parents choices for the spring semester. And every parent in Florida can take that to the bank. Now I'm going to let Commissioner Corcoran go into detail about his updated order, but the long and short of it is it continues the requirement that districts offer in-person learning and also contains the protections of school district funding. Now there's one, I think, new addition, which I think is really important, and I think it was very well considered, and is this: parents must be notified if a student is struggling with virtual learning. Still providing the parent the option to do virtual learning if they want, but they need to be notified, and then the student must return to in-person instruction unless the parent affirmatively opts out and says they want to still remain virtual. And the reason why we're doing that is because the data and the evidence is overwhelmingly clear. The virtual learning is just not the same as being in person. And I think teachers in Florida have done a great job of trying to improvise, and really, particularly in those early days, the fact of the matter is the medium is just not the same as being in the classroom. So we wanted to figure out a way to still offer the parents a choice, but to really put the onus on the school districts to be monitoring this, and when they see students fall behind, to really be affirmative and engaging with the parents. So I think it's a good model going forward. We're now 11, we really started looking at this issue of coronavirus in January, so we've done 11 months of this, and I would say that closing schools due to coronavirus is probably the biggest public health blunder in modern American history. The fallout in communities that are still chafing under school closures, we have some of the biggest school districts in our country that still do not have in-person instruction. Incidentally, of the top 10 school districts population-wise, 5 are in Florida, all 5 offer in-person instruction. But the harm from this is going to reverberate in those communities for years and years to come. And the tragedy of all this is that the evidence has been remarkably clear since the spring that closing schools offers virtually nothing in terms of virus mitigation, but imposes huge costs on our kids, on our parents, and on our society.
So we're very proud in the Martin County School District to be able to offer our doors open to all students in our community who would like to attend in-person instruction each and every day. And the main goals of the Florida Department of Education's emergency order, in our view, is to build upon the successful reopening of all public schools to in-person instruction. And a few quotes from the governor that you will hear if you listen to the entire presentation, his presentation. Schools are a safe place for students. Keeping kids in school is the way to go. Closing schools offers virtually nothing in terms of virus mitigation, and that students perform better in school than in a virtual model. That virtual learning is just not the same as learning in person. So goal number 1, bring our kids, all those students who are able to come back to school, bring them back in person to school. And here in our district, we welcome them. Number 2, to remediate the achievement gaps that have been created by COVID-19. And finally, to provide financial stability to all school districts in Florida. So here in our district, not only do we have our traditional in-person schooling available to us and to each and every student in our district, we also have the ability for students to participate in what we call our innovative learning environment. And that innovative learning environment was an option for parents to attend what we call remote learning at home, where we have synchronous instruction happening. Students are receiving instruction the same in real time, the same as their peers in the classroom. Now, the benefit of this is as students do have to go into quarantine or isolation, those students who choose to come each and every day still can participate in remote learning at home should the need arise. So these options will still continue to be available through the spring semester in the Martin County School District. So this plan, how did we develop it? We had input from 5 different task force teams, teachers, non-instructional staff, parents, healthcare professionals here in Martin County, and assessment folks. So the safety and continuity of instruction has been our main priority and continues to be here in the Martin County School District. And the questions that we really consider is how can we provide options for our families? How can we implement the CDC and other recommendations to the greatest extent possible? How do we provide educational continuity that we know is so important for our students and our staff? And how do we continue to provide instruction if students must quarantine or isolate? So these are really guiding questions that we use to help develop the plan that we have in place. And from the Florida Department of Education, right now, the information that they are giving us is unlike last school year, all students in Florida, regardless of what district they live in or where they attend school, all Florida students must take statewide standardized assessments in person. And so those tests are scheduled to be administered according to schedule. And this is the information that we received months ago and continue to receive at this time. So these statewide standardized assessments, you can find a schedule, a calendar of tests on the martinschools.org website. And those tests will be given according to schedule unless we hear otherwise from the Florida Department of Education. So a question we receive quite often is who can participate in remote learning at home? And this new executive order signed on Monday and presented to us lets us know a little bit of change to the students who are able to participate in remote learning at home. So those students who have signed up with us to participate every day in remote learning at home may continue to do so as long as they are successfully making adequate progress in their academics. So parents, if your children are not successfully making adequate progress and are participating in remote learning at home, we will be requesting that you return in person, that your child returns in person to school in January. Parents will be notified if that's a situation that your student is in. Students who are currently in quarantine or isolation, we encourage you to participate in remote learning at home on a part-time basis while you are at home. Or if you're sick, but well enough to participate in school, again, we encourage those students to stay home for the day or two they're not feeling well and to participate in online school through the remote learning at home option. And finally, students who are awaiting their own COVID test result or who have a family member in the home awaiting a COVID test result, we encourage you to stay home as well to prevent the spread of the virus. So while you're home, we want you to stay connected to your school. We want you to stay actively participating in your education, and you can temporarily participate in remote learning at home. Laptops have been provided to all students in our district, and we just ask that the parents send a note or send a doctor's note indicating the reason for students being present online if they're going to be out because they're sick or awaiting a test result. We really are discouraging students from flip-flopping from day to day and participating in school in one day and remote the next day, unless of course students aren't feeling well or are sick. Safety is the first priority, so if a student is sick, please absolutely stay home. Students when they do participate in remote learning at home, it's required that cameras are on, students are actively participating in lessons, and that they're in an environment that is conducive to having a successful experience with school. So the interventions you heard the governor mention, we will absolutely be offering those here in the Martin County School District for all students not making adequate progress. And again, students will be asked to come back in person to receive those interventions because we want all of our students to be successful. And as you heard the governor say, we will certainly be honoring the request if a parent would like the child to continue to stay home for some important reason to the family. We will grant that request, and parents will be required to sign a letter for us to grant that ability for the student to continue to participate in remote learning at home. Again, this is only for students not making adequate academic progress, and those parents will be notified via a letter from the school at the end of the second 9 weeks. So we will also be providing information about the supports that will be available, such as after-school programs, weekend programs, summer programs, All of these designed to meet the needs of our students and close the achievement gaps that may have been created due to COVID-19. So Mrs. Fisher is going to share with you some data that we have to share with you about our learning options.
Good evening. The district released public data dashboards earlier this fall on its website. You can access those from the homepage or from the Assessment and Accountability Department webpage as well. One of the dashboards is called Traditional Remote, and it provides data regarding attendance by learning option, enrollment by learning option, and student grades by learning option. This was to provide the public with real-time current data regarding the status of our traditional learners and our remote learners. The data is updated every evening at midnight. We do see that more students are choosing to come to school in person than in the beginning of the school year. At the beginning of the school year, we were 38% remote and 62% in person. And then I have a graphic on the next slide to show you the current numbers. And this data was accurate as of yesterday. And that's 27% remote and 73% traditional. So as you can see, we have a larger number of students coming to school in person now. When we look at grades, we're looking at average student grades as of yesterday, and this would encompass all secondary students in grades 6 through 12. Our traditional average grade rounds up to an 80, which is a B, and for remote learners, it's a 77, which is a C. So as you can see, a slight difference, but traditional students are earning a higher average grade than our remote students. When we look at the grade distribution, the top chart is showing you remote grades and the bottom chart is showing you traditional grades. You can see that a higher percentage of remote students are receiving, earning an F over traditional students currently. And then our attendance data is slightly better for in-school attendance. I think some people would be probably surprised to see that. It seems easier to attend school if you're at home, but that is not what our data is showing. It is showing that our in-school attendance is higher than our remote attendance. Again, this data is as of December 2nd. I'll turn it over to Mr. Grabowski to handle the operations portion.
Thank you, Nicole. Today, I'd like to share with you some of the operational items that we've done. I have 5 slides to go through. Back in February, we were first notified of this. We went into action in trying to source electrostatic sprayers and cleaning equipment. And then this slide here, it shows some of the steps that we took to stock in preparation of reopening schools. And what PPE stands for is personal protective equipment. So it's our PPE and cleaning procedures. And what we've secured is 900,000 disposable masks, 3,300 N95 masks, 2,700 gallons of hand sanitizer, 13,000 gallons of disinfectant, 6,000 spray bottles for the disinfectant, 80,000 packages of disinfectant wipes, 1,400 boxes of disposable gloves, 6,000 medical gowns, 4,000 pairs of safety glasses, and 2,000 face shields. Along, we've also purchased 2,100 thermometers, 8,900 microfiber cloths for cleaning, 114 hand sanitizer dispensers for the school buses, and 50 new cots for our symptomatic clinics stations. We've got a tremendous amount of stock in our warehouse, and it's all been deployed out to the schools with reserve at the warehouse. As part of our PPE and cleaning procedures, we've put into effect that all high-touch surface areas, this includes desks, school buses, service areas, door handles, switches, toilets, etc., are all cleaned and disinfected on a daily basis. The product that we're using is called BioEsk. It's an EPA-registered botanically based disinfectant, and it is used to disinfect these areas. As a district, we've purchased portable electrostatic sprayers in March, and these devices are used to rapidly disinfect the classrooms, cafeterias, gymnasiums, and other high-touch areas. All spaces that were occupied during the day are electrostatically sprayed with the BioS disinfectant during the nightly custodial shift. The district has also installed MERV 13 rated filters in all of our HVAC units. Each teacher has also been provided with a classroom sanitization kit to use at their discretion. We're not asking the teachers to clean, but if they needed to use it in case there was a situation, it's available for them. And each kit includes 2 microfiber cloths, a 32-ounce refillable spray bottle for the BioS disinfectant, and a 16-ounce refillable push pump bottle of hand sanitizer and disposable gloves. So these are first responder kits for the teachers in case there's an issue that needs to be addressed immediately. And also our school board, which we'd like to thank, approved additional custodians for us. And we've hired additional custodians to help with the additional duties associated with the pandemic. So thank you for that. And they've been a big help for us in operating the day-to-day operations. Some of the other things that we're doing as far as the feeding program through our food service department, our cafeteria procedures and meal informations. The table in the cafeteria are cleaned with the appropriate cleaner, allowed to dry, and then treat it with the BioS disinfectant between each lunch period. Additional meal periods, tables, and eating areas have been provided for social distancing throughout the district. We've purchased a good deal of additional tables and set up additional areas throughout the campuses. We've added additional mobile carts, kiosks that are set up in the bus loops and the car lines. It's for grab and go breakfast and meals of that sort. And our restrooms are cleaned, dried, and then sprayed with the BioS after lunches at the end of each day. So they're constant. We have basically perpetual cleaning happening. Contactless point of service has been implemented. Students can scan their ID badges, grab a meal, and go. Hand sanitizer pumps are located at each point of sale station on the cafeteria line. And it's important to note that the ID badges are contactless, so it's so that there's no transactions that are happening with cash or at the point of sale station. It's just the ID badge. We're also providing free breakfasts and lunches that are available to all children aged 18 and under every Tuesday afternoon. And every Tuesday afternoon, meals are served curbside at the following sites: J.D. Parker Elementary, Port Salerno Elementary, and Warfield Elementary. The total curbside meals served since March 2020 is 128,316. And we have the meals for our in-person learners. As part of our U.S. Department of Agricultural School Meal Program, the district has been allowed to continue providing free breakfasts and lunches to all children aged 18 and under through the 2020-2021 school year. Students who are attending in person receive these meals in school cafeterias, while remote learners participate in the curbside meal service each Tuesday. The district is pleased to announce the expansion of the participation in the after-school meals program, a subcomponent of the Florida Department of Health's Child Care Food Program, known locally as the Super Snack Program. This resource provides nutritious snacks and suppers to students at the conclusion of each school day. All district-operated elementary schools now offer free suppers and snacks to students every day that school is in session. So we're so proud to be able to provide that program to the community. And there is no registration required for this program. Curbside service is not available for this program. It is available to students who are attending school on campus. Snacks and suppers are available to students regardless of race, color, national origin, sex, age, or disability. And if I could add at this time, that even though the registration is not required, we encourage parents to complete the lunch application for the free and reduced lunch, because not only does it help provide the district with reimbursement through the program, but it also offers up many opportunities for students in other areas of school as well. And that application can be found at www.lunchapplication.com, and it can be filled out confidentially at your leisure. So we'd like to see if people would be so kind to fill that out. On the busing transportation side, our buses are disinfected with the BioS using the electrostatic sprayers when all students have disembarked between each run. Transportation employees complete a final disinfection process at the end of each day using the BioEsk and the electrostatic sprayers for each bus. And the students and employees are required to wear masks at all times while on the school buses. Social distancing cannot be guaranteed on school buses. It is dependent on the student ridership on any given day or bus, and students are expected that they can share their seat at least with one other student at all times. Hand sanitizer and pumps are available for students and employee use at the front of each bus. And students, we ask that all students swipe their student ID badges because it's an added safety measure and it allows us to identify who's ridden the bus when we get to the quarantine teams. So now I'd like to turn it over to our favorite Director of Risk Management, Julie Sessa.
Thank you, Mr. Grabowski, for that introduction. I'd like to talk to the public a little bit about our pandemic crisis response team, and it correlates to Dr. Miller's discussion about talking with healthcare as we returned back to school in the fall and as we move forward with our new plans for the next 9 weeks. The superintendent directed the creation of this cross-functional local team that includes health and medical professionals to establish medical trend guidelines for reopening schools using statewide components of the return to school plan that we've submitted. The local pandemic response team ensures that all local context, supports, and barriers are addressed and problem solved in a manner which reflects the community it serves. Our local pandemic crisis response team, we meet on a regular basis to develop, monitor, and make recommendations throughout this school year. Some of our team members include Cleveland Clinic's chair of the Department of Internal Medicine. We also have the chair of their pediatrics department on our committee. We have the local Martin County, Florida Department of Health. We have the Office of Emergency Management for Martin County, as well as representatives from elementary, middle, and high school principals. We have a great cross-section of people that have done a wonderful job reviewing all of our different concerns and questions the community might have for returning to school. So Mark Coco is going to tell us a little bit about the quarantines that are put together to help address quarantining and isolation. Mark?
Thank you. Thank you, Julie. Again, my name is Mark Coco. I'm the safety manager. And the school district, as a response to the COVID positive cases, has put together 4 quarantines that were created so that we could provide case positive direction to schools and departments in the school district. Each team responds on alternating weekday nights and weekends so that we can provide isolation and quarantine support services to ensure exposures in the schools are reduced as reasonably as possible and with as little disruption to the educational process as possible. Each quarantine has representatives from the Department of Health, Risk Management, Instructional Services, Transportation, Educational Technology, Operations, Human Resources, and the affected school administration. We did this because we wanted to make this an entirely collaborative process so that we could get to minimize how many people we have to quarantine in any one situation. The goal of the quarantines is to surgically approach the quarantine activities as opposed to making sweeping decisions such as removing an entire classroom or entire sport if we don't have to. The quarantine steps that we follow are very involved. It took some time for us to put together a spreadsheet. And it all starts with when the school district is notified by a positive case that impacts the schools. That could be done from a parent, a staff member, or the Department of Health that will notify us about those cases. What occurs then is the principal and school staff will review seating charts if necessary, visit classrooms to determine close contact to the positive case. Transportation and school staff review seating charts and bus videos to determine if anybody on the buses need to be quarantined. Parents are contacted to assist in determining close contact at lunches, to and from school, and after school activities, whether they're on campus or off campus. The health department will verify the positive cases and performs the case interview to determine further details of symptom onset, quarantine, and isolation dates as appropriate. What we do in the background is we provide the schools with information that they need to gather so that we can make sure that we're doing the right thing. Among the items that we look to get are the student's last day in school, whether or not there are siblings in the household or contacts in the district schools. We want to know their symptomatic dates, the first day of symptoms, and whether they're a bus or a car rider. We look at the bus seating chart. We look at the last day they may have been on a bus, because some don't ride the bus every day. We use classroom seating charts. We review the seating at breakfast, lunch. We look at whether there's an extended day exposure for elementary schools, whether there's any related arts involved. And then we run the focused contact tracing report to remove remote learners that definitely would not be impacted by any quarantine. We also determine if there's any laptops needed, whether there's any staff that need to be isolated or quarantined. Those include teachers, bus operators, one-on-one staff, or others such as administrators. So as you can see, we involve a lot of people to get to a lot of things. So once we collect that data, it ends up on the COVID dashboard, which Ms. Fisher will again talk to you about in a few slides here. And that COVID dashboard again is updated nightly. As we said, we go to great lengths to determine exactly who is a close contact to avoid unnecessary quarantine and transitioning to remote learning at home. So I will let Julie elaborate on the roles of each department.
Thank you, Mark. One of our intricate pieces is working with our local health department. The health department, and I see this question is in chat, Martin County Health Department confirms the positive case for us or a presumptive positive case. They also obtain information from our schools on any exposed staff or students. Another role is they assist with contact tracing each individual to determine the isolation and the quarantine level. This is done through the epidemiology department in Department of Health. They call the parents directly if it is a student that is affected and speak with them with regard to onset of the case and lots of other pertinent information. Also, our school nurses at each school site provide an intricate role with knowing students and families, how to contact them, and they also do part of the epidemiology investigation. They inform isolated and quarantine children or staff and parents of students for expectations and to reduce how to reduce the local spread, because there are specific things to follow when you're in quarantine or when you're in isolation. They also follow up with the affected individuals through isolation and quarantine periods. They'll call back and monitor if there's any changes. If someone is in quarantine and becomes ill, they have an epidemiology contact they can speak with, and they'll help make recommendations. The health department also keeps the school district advised of any CDC updates and changes to the quarantine and isolation protocols. So in general, they are our medical arm. We follow what the Martin County Health Department says with regard to medical quarantine and isolation that happens at school. The school district's role is we initiate the collection of information on affected students or staff identified by the school, and based on confirmed positives and presumptive positives, as Mr. Coco was mentioning. One of the things we do is we initiate a Zoom meeting with school administration, the Department of Health, and the quarantine on duty to collect data and file to be used. So we go through isolation and quarantine individuals. We go through determining the length of isolation and quarantine. And we also populate a spreadsheet that then gets uploaded into the COVID dashboard that Mrs. Fisher is going to go over in the next few slides. The next piece that happens is our superintendent's cabinet is advised of every COVID case that happens on a daily basis, so they're informed of affected students and staff. There is department roles as well. Our instructional services department supports schools to maintain the instructional process for traditional and remote learners to the extent possible. As we covered, transportation provides student seating information to determine proximity of seating of students transported by the bus, and we also have video capability on the bus. Our educational technology department has done an awesome job ensuring all of our students who need to transition to remote learning have laptops and access to school remote learning devices. As Mr. Grabowski went through, our operations department ensures schools are provided with PPE, custodial and disinfection of the infected schools and buses, and they also provide our food services for our students. Human Resources works with our affected staff for their COVID leave options and essential worker responsibilities. And the risk management team coordinates the efforts of the quarantines to ensure the protocols are followed and all precautions are taken to reduce the spread of COVID-19. Risk management also establishes risk mitigation strategies and monitors CDC guidelines. And we are remiss in our student services department is also part of our process and quarantines, and also is over the health assistance and helps us manage at the school level with regard to department roles. Parent and guardian roles is probably one of the most important things that we would like to get out to parents today as part of this presentation. We really want to make sure you report symptomatic and positive cases to the administration at your child's school. If it's after hours and you become aware of your positive child or a positive family member in your home, you're welcome to call our district's dedicated COVID hotline. That number is 772-260-8071. So again, monitor your child's health, and we have a daily symptom screening tool. As part of this presentation, you can click on this link and receive the screening tool. You can use it daily. And to keep your children home, if they or anyone in the household is symptomatic, the next piece, are they waiting test results or they have tested positive for COVID-19? Children who are staying home from school due to any of these reasons must also refrain from participating in activities, sports clubs, gatherings outside of the home. Why is this important? Because sleepovers can pass on COVID-19. Attending a birthday party can pass on COVID-19. So if you're in quarantine or ill or sick, we ask that you do not participate in extracurricular activities. The other thing is to ensure your child's active participation each school day. If your child will be participating in remote learning at home temporarily due to illness or the status of someone in your household, provide notice of your physician's note to their school and follow those recommendations that Dr. Miller spoke about, making sure your child is actively working and participating during the school day while in remote learning. Mr. Coco is going to go over some health guidelines. Mark, take it away.
Thanks again, Julie. As Dr. Miller and Julie has stated before, please, if your child is sick, please keep them home and seek medical diagnosis. Understand that extracurricular activities in and outside of school can cause quarantines not only to your child, but can affect other children and school district staff as well as other parents. Stay vigilant. This pandemic has been an endurance test for all of us. Confirming that your children are wearing masks, washing hands frequently, and using hand sanitizer with 60% alcohol, and most importantly, social distancing as much as possible, are the best practices that keep your children safe as well as other children. If you are contacted by the Department of Health, please provide as much detailed information about your children to ensure any quarantine activities are as complete as possible so we can help stop the spread of the COVID virus. I will turn it over to Nicole Fisher to discuss a little bit more about the COVID dashboard. Nicole?
Thank you, Mark. The district released a public dashboard to provide some insight and transparency into positive COVID cases along with the associated quarantine numbers, with the report beginning the first day of the school year on August 11th. The dashboard's updated every night at midnight and is based on the data that are collected during the quarantine meetings that you had heard about. You can access the dashboard from our martinschools.org website. The data shown here is as of 12/2. When you open the public dashboard, on the left-hand side, you'll see cases, and on the right-hand side, you'll see quarantines. Again, this updates every evening at midnight. On the left are the cases with the date notified on the bottom. It shows you how many staff, how many students, and then other would be non-employees that may be in our schools, vendors or service professionals. We're reporting none of those right now with COVID cases. You can filter by school type, or by location, meaning Stewart, Indiantown, Jensen Beach, Palm City. And you can look at the data that way. In the bar graph, blue indicates staff and red indicates student. And on the right-hand side, you'll see quarantines. There's a button for active quarantines versus all quarantines, and it'll show you the number of staff and students. We're not live on this presentation, but if you hover over the bar, it'll show you the date quarantine began and the eligible return date for each of those quarantines. I did want to address one of the questions that I saw come up in the chat, was that the notification date and the quarantine dates don't match up. So what happens is when the quarantine is notified of a case, they do a look back for the contact tracing. So the quarantine date for the look back may actually begin a few days prior, which is why if you look for a date notified at one of our schools, the quarantine date may start a few days before because of a weekend or a holiday. It could even start, it's not going to necessarily match up because the date notified and the date the quarantine began are not necessarily the same. Testing is not generally same day. I will send that back to Dr. Miller now.
Thank you. This is the second in a series of Parent University programs that we've offered in the evening for parents to keep you informed of important topics here in the Martin County School District. Our first Parent University was held in November, and our topic was all about the digital devices and the programming happening in our schools. I saw there was a question in the chat where the parent thought that tonight's presentation would be more about navigating the in-school or the remote learning at home. We really did cover that quite a bit last month, and so that video is available on our website and can be viewed at any time. We do have additional topics coming up right now, tentatively, unless we get a lot of requests from parents and community members for another topic. We'll be talking about required instruction in our schools. That will be on the December 7th Parent University. And coming up in February will be programming options to discuss some options that we have available, such as our International Baccalaureate program, our advanced placement programs, our Cambridge programs, CTE programs, and others that we will be letting parents know to help with their student choice selection of courses coming up for next school year. So we definitely welcome you to suggest topics that are of interest to you in the chat for this evening. So we do have a few additional questions that I believe we could answer live. And Julie Suss, I don't know if you got additional information from our Department of Health, Martin, about whether or not Martin County Department of Health will be looking at the new CDC guidelines that were just released for quarantine.
Yes, we were in conversation with them today. At this time, the district is still following the 14-day quarantine, while the health department reviews with St. Lucie County and Palm Beach and Indian River, and how they'll have a combined response on how all the local districts will be managing that. But it does look like that quarantine time will be shortened either 10 or 7 days, depending on how that's managed in the new CDC guidance.
Thank you. A couple other questions that we have time for a few. The parent commented that remote learning has been difficult, that parents are not the teachers, and we certainly understand that. The remote learning is a solution that we've provided to parents who do not want to send their children to school because of concerns related to COVID-19 and other related health conditions or other health conditions where the child can't attend school at this time. So we're pleased to be able to offer that option for parents as our innovative learning option, and the governor has allowed us to continue that. We are not looking to move away from that model. It does provide continuity of instruction so that students can come back to school. The goal is always to come back to school and be in the environment where students can be with their peers, where they can be in person with their teachers and have the most optimal learning environment. Certainly we understand that in this pandemic that isn't possible for all students, and we welcome those students to continue to take advantage of the remote learning at home option as long as students are progressing and they're making adequate academic progress. They will not need to take any action to continue in that model and won't be receiving any communication from the school district. Students will just continue to participate in remote learning at home. For those students who are struggling and are not doing well academically, again, those students will be requested, as the governor said, they'll be requested to come back to school where we can provide the instruction, the monitoring, and the supports that students definitely need. We also want to let parents know that at any time you can send your students back to school. Please just give a call to the school, the front office, and let them know that your child will be coming back to school and they can come back as soon as tomorrow. You can make that transition at any time. You don't have to wait for the start of the second 9 weeks or wait for any particular time. We're happy to make that accommodation available to parents and to students so that they can participate and benefit from the quality education and our outstanding teachers in the Martin County School District. I'm going to look at the team to see if there are other questions to be answered live today. A question about testing. Any information about those who test positive, wherever they test, that information comes to us through Department of Health Martin, and they have a network of support throughout the state through the Department of Health. And so we rely again on the Department of Health for that information. Team, other questions?
Dr. Miller, I see one with regard to when are volunteers going to be allowed back on campus? And you know, we've been monitoring that closely. Currently, Martin County is just under 8% along with the state for positivity rate. Unfortunately, this has continued to rise. So at this point in time, we are monitoring, but feel like at this time, keeping school closed to volunteers has really helped us reduce the spread. So at this time, it is not something we're looking at in the near future.
Other questions? Any questions we don't get to that are in the chat this evening, we will research and respond back. There will be the question and answers, and this video will be posted on the martinschools.org website. Again, we're encouraging all of the participants to let us know what topics you're interested in and how we can continue to help educate parents in our community about all of the amazing things happening here in the Martin County School District. So we'll leave that chat open for a few more minutes. And again, we appreciate each and every one of you. Appreciate you spending some time with us this evening. And we encourage you to keep in touch with your local school. And we're ready to welcome our students back as soon as they're ready to come see us. Thank you to everyone. Have a great evening. Mr. Hall, thank you.
My pleasure. Are we ready to end?
We are, thank you.
You're quite welcome. Good night, everyone.
Good night.
Good night. Thank you.